Hey everybody, it's Matt and Josh from Upright Health, and today we're answering a question that I got from Tammy in the UK. Tammy basically said she had strained, maybe possibly torn something in her inner thighs, so adductors, about 6 to 8 months ago, and her doctor just said you gotta lay off and stop doing stuff. And what she found was that not doing stuff, how does that normally feel?
Not good.
Yeah, not good. So she felt like, well, if I don't do any exercise, my body doesn't feel very good. She also has hip dysplasia, which is when you have a shallow hip socket. Your acetabulum is just really shallow. And so she said if she doesn't exercise, then things feel more unstable and her knee starts turning in more, which is internal rotation of the femur. So, so that got Josh and I talking about a couple topics related to this, but we want to be kind of short and sweet with this. So, Josh, let me have you actually show everybody the internal rotation. So, that's his knee right here, kneecap, where are you, right here? So it's just pointing straight forward, and if you give us real internal rotation, right, then we're thinking about actually, it's not like the knee itself is this free-floating thing that turns, it's actually a turn that happens from the femur. So what Tammy is talking about is basically her whole femur doesn't know how to maintain its position, right? So what happens if you try to do any sort of bending motion, Josh?
I'm getting all crammed up in here.
Right.
Does not feel good.
Squatting?
No, squatting would be terrible.
Right, so
Yeah.
it's even hard for him to fake how bad that would look and feel because we just don't want to do that at all. So what can Tammy do to try to help correct that internal rotation? What kind of things would help? Would stretching help? Would smashing help? What kind of things can you do?
Yeah, I think taking that approach to it, stretching, smashing, but like we talked about, there's probably got to be something else put in there as well, right?
Yeah, right. So like the stretching and smashing, if you're doing things in here, first of all, she may have torn something, I don't know, so maybe it's not a good idea to be poking and prodding and wrecking stuff in there, but stretching and kind of opening that up might help. But what's the other thing she might have to do?
We gotta strengthen.
Gotta strengthen. So what kind of exercises can she do for the outer hip?
So probably probably doing some glute bridges. We can do a single leg glute bridge to work on that specific hip to kind of overload that, because it looks like that's really what we need there. Right.
Yeah. So a lot of unilateral exercises we can use. You can use a rubber band and stick it around their thighs and start doing things like that. Anything to isolate here to really wake up your lateral hip
Quadruped
musculature.
kickback will be great for that as well.
So like a donkey kick.
Yes.
I don't know if anyone can still see me, but things like this. You want to start with easier stuff that's a little more isolating those muscles, and then you can start moving into the harder stuff that moves your whole body. Start doing full squats, making sure that you're feeling the right muscles kick in. In Tammy's case, it's probably really likely that she's going to be using the adductors a little bit too much. So Tammy, you need to make sure you focus way out here, make this work. And what you'll find is if your butt muscles are firing more, it's going to start to pull your femur out like that. So hope that helps you out, Tammy, and anybody else who's thinking about what they can do for that internal rotation of their femur. And hope you remember that pain sucks.
Life shouldn't.